Christian Andreas Doppler was born in Salzburg, Austria. Throughout his life, he published over 50 articles on mathematics, physics, and astronomy. His most famous work was On the Colored Light of the Double Stars and Certain Other Stars of the Heavens, which was published in 1842. This famous work was based on the aberration of light. Doppler wrote that the color of a star is caused by the relative motions of the star and the Earth, causing apparent spectral shift of the emitted white light. The spectrum would shift toward blue if the star approached the Earth, but the spectrum would shift toward red if the star receded away from the Earth. This was his explanation of redshift. So to explain redshift in more detail, it involves light waves and frequency. A star zooming toward Earth has squeezed together light waves that have a higher frequency than normal. A star zooming away from Earth would have stretched out light waves due to a lower frequency. Because blue is at the high frequency end of the spectrum and red is at the low frequency end, light from a receding star is called redshift. The Doppler effect is an apparent change in frequency which results from a change in wavelength because of motion between a source and an observer. Imagine that you are standing still in a subway. Listen to the different pitches as the train comes into the tunnel and rushes past. The Doppler effect is illustrated by the change in pitch that occurs as a high-speed subway train approaches and then speeds by. As the train moves toward you, the wavelength compresses, which produces a higher pitch. When the train moves away, you hear a much lower pitch as the wavelength elongates. The Doppler effect was initially used for astronomic studies. Then as technology advanced, it was used in World War I. Any guesses on how it was used in the war? If you guessed it was used in the form of sonar to detect submarines, then you're right. In the late 1950s, Doppler was introduced into the medical field, specifically for ultrasound. These days, Doppler is also used for things such as weather radar.
Doppler shifts can be positive or negative. Does a positive shift work better than a negative? No, shifts are proportional to the velocity of the reflectors. A positive shift is when the source is getting closer to the observer. This results in compressed wavelength and higher frequency. With the positive shift, the blood movement is towards the transducer. A negative shift is seen when the source is getting further away from the observer. In this case, the wavelength elongates, resulting in a lower frequency. In an image, a negative shift represents that blood is moving away from the transducer. There are many parameters that affect the Doppler shift frequency. Velocities of a sound source from red blood cells, transducer operating frequency, angle of incidence relative to direction of flow, and propagation speed, such as the average speed of sound in tissue. The Doppler equation expresses the relationship between these factors. Frequency shift is what we see on the image through color. As sonographers, we can affect the shift through transducer frequency. Using a higher transmitted frequency results in a higher frequency shift for any given velocity. What is a sonographer's best controlling factor? Angle, angle, angle. A 90-degree angle results in the lowest possible frequency shift for any given velocity, whereas a 0-degree angle, which is parallel to flow, results in the maximum. An angle of 45 to 60 degrees results in the best frequency shift. Color Doppler gives us qualitative information. Autocorrection is the method of processing frequency shifts of color flow. This modality uses multiple scan lines contained within the region of interest to create a real-time image of frequency shifts related to blood movement. Each pixel within a color box has its own averaged velocity with a color representing the direction of flow. Using the frequency shift equation, multiple pulses sent along a scan line are evaluated for frequency shift at various depths. Other controls can optimize this color. The color bar is the guide to flow direction and estimated mean velocities. The top of the bar is the positive Doppler shifts, which means towards the transducer. The bottom of the bar is going away, which means a negative Doppler shift. The black band in the middle means zero Doppler frequency shift. The numbers above and below the bar are the scale. The scale controls the pulse repetition frequency and therefore the velocity limits of the display. When the PRF is set too high, low velocity, such as in diastolic flow, may not be spotted. The control color gain is responsible for changing the strength of the signal displayed by the machine. Doppler gain should be adjusted to alter sensitivity, which varies per tissue, interfaces, and composition.
Color Doppler is a key component in a variety of ultrasound exams and is utilized by most ultrasound modalities because it offers a range of valuable information. It provides a quick visual overview of flow within a vessel. It aids in the identification of vessels in various flow patterns, and it allows the sonographer to assess both flow direction and velocity. Color Doppler aids in the diagnosis of several conditions, such as thrombosis or blood clots, arterial stenosis or occlusions, which are narrowings and blockages in an artery, venous insufficiency, meaning poorly functioning valves in the veins, or aneurysms, which are bulging arteries that are at risk of rupturing. As sonographers, it is important that this function is utilized correctly in order to guarantee that the correct diagnosis is being attained. The most important step is to optimize all appropriate color Doppler controls before the interrogation of possibly diseased areas. To do this, the vessel must display complete filling, which means the color fills the vessel from wall to wall. This will help decrease any confusion if plaque or any other irregularities are encountered later in the study that may cause disturbance in blood flow. To maximize color filling, the sonographer utilizes the controls gain, angle, and scale, which creates the acronym GAS. Color gain controls the strength of the signal displayed. It is important not to use too little gain because this diminishes the sensitivity of color flow and will not detect the correct number of red blood cells demonstrating a particular velocity, which will lead to inadequate color filling. In order to optimize color gain, it is best to adjust the gain slightly too high to the point where color flow appears to extend beyond the vessel walls and into the tissue. Back the gain down slowly so that the color artifact is eliminated and the vessel is adequately filled. The second step is to be mindful of the direction and size of the color box. The angle must be optimized to create a good Doppler shift with the transducer and blood flow. To do this, the color box must be steered in the direction of flow to create the optimal angle, which is between 0 and 45 degrees, with the vessel under interrogation. The color box needs to be sized appropriately as well. Ideally, the sonographer should take advantage of the largest box area that still maintains an adequate frame rate. A wider area requires more sampling beams and therefore more information that needs to be processed, which slows down the frame rate. To improve a sluggish image, reduce the size of the color box to include just the area of interest in order to improve the frame rate. Lastly, the color scale needs to be adjusted constantly for changing velocities. Generally, the color scale BART, which stands for blue away, red towards, will be used to show that vessels coming towards the transducer are displayed as red, while those going away are displayed as blue. However, it is common to see the color scale switch to rabbit, meaning red away, blue towards, to keep all arteries encoded as red and veins as blue. The rule of thumb is to adjust the velocity so that the vessel is a medium shade of blue or red, depending on the type of vessel that's being investigated. This ensures that any focal flow acceleration will alias, alerting the sonographer of potential flow disturbance that will require further interrogation. Color Doppler equipment can quickly identify abnormal blood flow. It shows a comprehensive display of each part of the blood flow, helping improve diagnostic accuracy. When there is a change in the rate of blood flow, the scanner shows possible interruptions or abnormalities that are associated with blockages, tumors, and other conditions. Color Doppler scanners are the only devices that are effective to evaluate the blood flow to this extent that helps to determine the health and condition of the organs. They show a clear indication of blood pooling and changes in flow rate that makes diagnosis much easier for the doctors. The velocity information given by color Doppler is qualitative. It indicates average Doppler shift information and not specific velocities. Using color Doppler results in poorer temporal resolution with increased depth. Poor spatial resolution is a limitation of color Doppler, especially with a curved or sector transducer, when interrogating vessels deep in the body. In these situations, color can exceed beyond the vessel margins up to 4 times the size of the vessel. Aliasing occurs when abnormally high velocities exceed the rate at which the system can record the velocity correctly, the Nyquist limit. Just as the Nyquist limit affects spectral Doppler, a frequency shift of the PRF divided by 2 will be displayed in the color of opposite directional flow.